Hi there, my name is Raven, and today I'll be pointing out the anatomical features of the bone. To start off with, we have the epiphysis on either end of the long bone, and then we have the diaphysis, which is the shaft of the bone, and it houses the bone marrow along here. We also have the epiphyseal plate, also known as the growth plate, and we also have the nutrient foramen. So the nutrient foramen will be on the outside of the bone. It'll be a small hole that'll allow blood vessels and nerves to penetrate through the bone into the bone marrow. So there's two different kinds of bone within the bone here. So the diaphysis is made out of compact bone, whereas the epiphysis is made out of spongy bone, but covered with a layer of cortex, which is the compact bone over top to kind of strengthen the outside. Spongy bone is also called cancellous bone. So within the bone, we do have the medullary cavity, which is right in here, and this houses the bone marrow within the bone, the shaft of long bones. So we have the endosteum, which is a membrane lining within the inner layer of the bone along in here, and then we have the periosteum, which is a membrane lining on the outside of bones. Next, we're going to talk about the parts that make up the joint. So in the joint here, the joint is held together by a joint capsule, which is a membrane that holds both ends of the joint in together. There is a lining on the inside of the joint capsule called the synovial membrane, and that synovial membrane produces synovial fluid. And the synovial fluid is within the two articulating areas within the joint capsule to make it so that the joint can articulate and gives it some fluidity so that it can bend. Then we also have the meniscus. So the meniscus is two little discs that the femur sits on and can compress into onto the top of the tibia there. So on the distal end of the femur, you can see that we have some articular cartilage here, and this is to give a smooth structure for the joints to articulate on. So the tibia also has articular cartilage on this aspect, and articular cartilage is made out of hyaline cartilage, and so they are what allows the joint to slide smoothly within the synovial fluid. So here we have a cross section of the patella. So if we were to combine this joint back together and bring the patella back together, it would ride here along the trochlear groove. So right here is that articular cartilage that it would slide up against. And so then on the inside here, you can kind of see we would have one of the medial or lateral condyles. So if we were again to put this bone back together, this would be the lateral epicondyle, and this would be the medial epicondyle down in here. This one is epicondyle up here, and then these ones within are the condyles. They're kind of hard to see within all the fat, but they are right there. So that would be one of the condyles, and then this one up here would be the epicondyle. And that one does not articulate on the joint, whereas this one would articulate with the tibia. So on the tibia here, unfortunately, it's quite a bit chopped off. So we do have the bit of a tibial crest. So the tibial crest is this little point here would be the tibial tuberosity, and then it would continue down to create the tibial crest. Unfortunately, we have lost most of it. And then on the lateral aspect of the tibia would be the fibula would have come out on the lateral aspect of this. But again, we don't have that part of the bone, but we do have the tibial tuberosity right there. Then we have the ligaments of the joint. So we have the caudal cruciate ligament and the cranial cruciate ligament, and they kind of cross each other as an X kind of look within the joint. So the cranial is the one that would end on the cranial aspect, and then the caudal is the one that ends at the caudal aspect. We also have the patellar ligament. So the patellar ligament here, if we were to put the patella back together, it houses the patella over the trochlear groove here, and it actually starts out as a tendon from the thigh muscle, but once it's at the distal end of the patella is called the patellar ligament. Then we have the medial and lateral collateral ligaments. So on either side of the joint there would be a ligament from the femur to the tibia and from the femur to the tibia, and that hole helps the joint not to slide sideways, so it holds them together like so, whereas the cruciate ligaments stop it from going front and back. So for the medial and lateral collateral ligaments, this would be the medial collateral ligament on this side and the lateral collateral ligament on this end here. Also, if we had the fibula, it would have come down and been on the lateral aspect as well of the joint. One last thing I'd like to mention, so I did say cranial and caudal cruciate ligaments, but they are also sometimes referred to as anterior and posterior. So typically anterior and posterior is used in human medicine to show like the anterior aspect of a person, the posterior aspect of a person, whereas we would say cranial and caudal. So when I say anterior cruciate ligament, I mean the cranial cruciate ligament, and when I say the posterior cruciate ligament, I mean the caudal cruciate ligament. So there's a little bit of differences in there between veterinary medicine and human medicine. So a veterinarian might do something called a drawer test, whereas they take the bone and they take their hand on either side. So we've got our femur here and our tibia here, and they might try to move the bone to get a forward or backward motion to see if one of the ligaments has torn. And then that's a good way to know if the dog or cat has torn the one of the either the cruciate or the caudal, the cranial or caudal ligament.